Hello, my name is Dr David Armstrong and welcome to this presentation on enabling positive behavioural change. I can be contacted at david.armstrong@flinders.edu.au, and please remember that you can pause this presentation whenever you wish to further consider or to take notes, and it would be helpful to you probably as we go along if you have a pen and paper available, so you can take your own personal notes on this presentation. This presentation will be helpful. This presentation is considered in the light of the previous ones I've produced, including that on ASD and challenging behaviour. And I'm going to frame, for example, I'm going to frame this presentation in terms of those presentations and also in terms of working with children or young people who have autism. But we're going to tackle some of the deeper and more philosophical but also highly practical elements of change in what follows, and I shall explain right now. So, I'm going to get you to consider what positive change in a student's behaviour is and what it might involve. But I'm also going to think about some of the bigger issues here, such as how we can avoid a deficit view of children, and also think about how we need to change our practices potentially to meet the needs of individual children. And this is pertinent, of course, to the very practical assignment 1 and assignment 2 in the topic, where we're asking you in assignment 1 to conduct a functional assessment of behaviour, and then in assignment 2 to feed that into designing a positive behaviour support plan. Now, in that endeavour, particularly as part of assignment 2, there may be elements in there which require some consideration of change by you about how you can meet a child's needs, and once you've identified in assignment 1, how you then go on to design your plan about how you're going to meet them. And part of this, of course, is designing an intervention, a positive behaviour support plan, an intervention which is detailed in there, which is realistic, achievable, can be maintained, and has a chance of success with a child. So this presentation talks about that process of how we not only go through the kind of the planning of change, but how we can we can gain change, but we can sustain change. And in my experience, that's one of the main difficulties which practitioners have in this area. The best laid plans of mice and men and all that change is planned for and anticipated and funded and organised, but then there are difficulties with keeping that change up, carrying through interventions, making sure and monitoring the progress that's been made with the child on those interventions. And to help you think about this and improve this in your assignments, when you write about it, but also in the practice out there after the topic, when you're in the classroom, to think about cognitive behavioural models for achieving change, and also think about the trans-theoretical model as a helpful framework process for helping us to be realistic and design realistic plans for change. Okay, so first of all, part of that is recognising that we have to have a bit of a change when we're in our behaviours, when we're thinking, or mental viewpoints at least, when we're thinking about functional behaviour assessments, and this whole process is a data-driven process that we're encouraging you to adopt. Now, some of this involves us becoming a detective, where we have a hypothesis, a working hypothesis, the best guess about a child's behaviour, remember, from a functional assessment of behaviour. That's one of the underpinning ideas of that. And of course we have to then analyse the data. Look, the scientist there is thinking hard on the bottom right hand image of the scientist there, the female scientist, thinking hard about what this data means and analysing it. So there are particular mindsets that we're asking you to adopt there, and that do involve change actually, because of themselves, because we're asking you to make an observation, form a best guess, a hypothesis, Perform the experiment, that's it, do the observation for your functional behavioural assessment. Analyse the data, report your findings, and this is the bit, number 5 here, I guess, is really assignment 2, where you're feeding through your findings into a behaviour support plan, where you talk about what that will mean and what are the factors to consider, and where we're asking you to design this positive behaviour support plan with a description of the learner, with your FBA detail in there, and talking about the replicable, reliable, specific intervention strategies that you would need to use, and rationale as to why you'd use them, and where you put your data collection procedures about, what information you've gathered, and a description of how you determine the effectiveness of your support programme. Well, in order to evaluate that, you need to think about, how do I sustain that? Because, sustaining it is part of the later evaluation. If you can't sustain it, you can't evaluate it, etc., etc. So, adopting these is part of assignment 2 and also part of assignment 1. So, thinking about this change. So, in this topic, in the topic as a whole, we have outlined the effective use of a functional behaviour assessment, FBA, as part of assignment 1, so you can achieve assignment 1. And we've also talked about, in terms of assignment 2, how you can produce a viable positive behaviour plan. But as I said earlier, and these two should speak to each other, of course. Assignment 1 leads into assignment 2 and should inform it. But both of them are part of a process, and this process needs to be effectively implemented and sustained, and that's part of your write-up in assignment 2, where you say how it's going to be effective and how you're going to sustain it, a rationale of what you use, selecting methods you used, and describe the learner and all the rest of it. So there's the rationale about where you're explaining this process of designing a plan and why you've chosen particular parts of the plan in particular ways, what interventions you've chosen. So as part of this, the question arises, and this is for your practice outside of the topic, but will also enrich your understanding of the topic. The question might arise, hang on, I've written this plan, we can't do that, there's a problem here, there's a thing here, we need to change to meet these learners' needs. So, question arises, do we as colleagues need to change our practices in setting to be able to meet these needs, which we've identified via a functional behavioural assessment? Now, there's been research done on this, and this appears to be one of the absolute major issues for educators working with children who have disabilities, particularly those such as children with ASD who also have behavioural issues. Research a colleague and I did in 2012 with children with emotional and behavioural difficulties suggests a pattern of unhelpful attitudes, helpful perceptions by educators towards children with SEBD, which educators themselves, the participants in this study, identified actually, some of them. And we certainly picked them up, which were, number 1, I'll go through them, the Humpty Dumpty approach. This child can remain normal again if they conform, and I can help them conform. We can bring the child back together with them. I can save the child from this negative behaviour. Now, as we said earlier, FBA, the whole process of functional behaviour assessment and positive behaviour support, says that we facilitate and encourage and support change and work with the child to help them change and adopt behaviours. We cannot externally impose change, so that won't work. We can't make them whole again, and remember when we've in previous presentation I've talked about how a child's behaviour can never be destroyed. We can only provide a viable alternative and encourage the child to take that alternative up and point out the advantages to them of taking up that alternative behaviour. And that's part of the FBA process. Another problem was that the issue around seeing the child in deficit terms. And if we're having a focus on a child's behaviour, functional behaviour assessment, i.e., there is a danger potentially there of seeing a deficit. We're looking for problems. We're actually focusing on a challenging behaviour which we want to change. We want the child to change. So the danger in that is that we focus on deficits. And now, of course, these are things to avoid in your assignment. So, when you're writing about your assignment, be aware of these pitfalls or dangers. And also, we want to encourage you, of course, and I'm sure you agree, with thinking alternative ways to avoid these deficits. They're not good. They're not helpful to anybody. So, fear and uncertainty is one of the next ones, where, and we all get affected by this, but the educator or professional is frightened of losing control, and there often seeks refuge or psychological comfort in teachers' tips, in forms, in systems, in rules, or bureaucratic exercises such as IEPs, NEPs, learning plans. So these are the refuge for us from the reality of having to actually work with children and potentially colleagues to achieve change. Something to be aware of, and quite understandable, but it can be really disabling for us, because we end up filling the forms. Form looks great, it goes in the filing cabinet, and then nothing happens from that. We feel like we've done our bit, but obviously it's just things written on paper, and think about that to avoid that. There's always a danger in institutions that the documentation ticks over and obviously reassures us that everything's okay if we fill it in, but of course it's not. So we have to make this change in reality. So that's something I've experienced in the past, I know in practice. So now the next one is interesting one, which some teachers in the previous study I mentioned, the Armstrong and Hallett mentioned. Now these were the teachers who were actually really good teachers, really, really good, skilled, great teachers. They sometimes felt professionally disabled, and that arose from an awareness that they wanted to meet the child's needs, they wanted to help that child change their behaviours, and maybe alter school systems and behaviours of colleagues even, to help them do that. However, policy and practice didn't necessarily encourage that and even put up barriers for them to do that. And going way back to another presentation, we may remember the attributes of a positive behaviour service, which Peter Baker, the clinical psychologist, spoke about. What were the attributes of a good service? And he talked to that really. He talked about how there were barriers in terms of the system putting problems in the way and putting barriers between the professional and in his terms, a client, or in our terms, a children or young person. So preventing us from meeting that child's needs and helping that child grow and develop and having a rapport with them. So the things that could get in the way from the system. Now some teachers are acutely, often the very, very skilled teachers and perceptive teachers can realise these barriers are there and can feel professionally disabled and become quite demotivated actually against those. So they're things just to be aware of. Some of them are highly practical to help you with your assignment, others more things that you might want to consider about in terms of practice beyond study for this topic. So let's talk about practical ways in which we can avoid these barriers, we can get around these problems, and also things that can help us produce a very nicely written assignment too, which is observable, measurable, realistic, time-bound, and all the rest of it, all the good things that we need in there when we're talking about interventions and why we've chosen interventions and why they're going to work and be realistic and achievable. So there are two paths. I'm going to talk about both of them. There's a research path, which is where we use an FBA and we we adopt a research practice in our in what we do. So part of this is where we think about some of the questions we might have if we're going to be a practitioner researcher, and which is supported by this topic actually, where we're asking you to do research, and particularly later on in other topics in the program. But we have the practitioner researching settings where we're asking to go out and find out what the issues are, do some research, and then design a plan or a report about those issues. And Armstrong et al. In their study, in their text, devote a whole chapter to these issues. So, and some of the questions that we can have, and these actually might, most probably, some of them will appear in your plan in assignment 2, where you're talking about, for example, if you talk about learner characteristics, you might talk about, the learner's social emotional needs and what their capacities, which Armstrong describes as core capacities. What's the things like self-regulation and language and attention, memory, all of these things that the characteristics of the learner that they need to learn. Of course, coming in there, not something you might put in your assignment 2, but something you might consider when you're designing your intervention. What are the attitudes of staff and peers? What are the issues around peers? How do we enable inclusion? We want to do things that are inclusive. Also, what issues around parental support do we have? Do we need, for example, if we're teaching the child replacement behaviour, as I said previously in the previous presentation, ideally we need to bring in parents. Do we have the support of parents if we want to do that? We want to bring in parents if we're teaching the child replacement behaviour, so that they can not only do it at school in our classroom, but also at home, so they can generalise it and generalise that replacement positive behaviour. So these are things to consider, and if we're doing that, we need to think, well, do parents support that? Will parents even engage with us to do that? Now, here is the other something else to consider, which is the process of achieving change. So we can do research into our practice, and we can complete our functional behaviour assessments and write it up and fill in forms and observe and do all that. Great, fantastic. Great, you've written assignment 1 and assignment 2, well done. You've identified what the working hypothesis, you've tested it out with observation, you've backed up your hypothesis about what you think the forms and functions of behaviour are, and then you've done all that, written all that up, excellent. Then you've gone to assignment 2, and you've put all that into a really good positive behaviour support plan, thinking about learners' needs, all that, lovely. But underpinning all of this, of course, there's also a process for achieving change. And this is a bigger process, but it will help you, I think, gain insights from this topic, but also in your practice in a much wider sense, and be really helpful to you. So to start with, I want you to get the insight into this process of achieving change, was to think about the last time you had a major lifestyle adjustment. So, when you last had to diet, give up smoking, give up alcohol, give up gambling, and maybe start regular exercise, or start a new and demanding job, or give up a job, or some change in your lifestyle, major change. So, in pairs for this activity, I'd like you to please share and discuss any challenges you faced in this major lifestyle adjustment, noting these down, and remember that you can pause to give yourself time, pause the presentation to give yourself time to conduct this activity. In presumption that you have paused and done that activity and now moved on, I'm going to introduce the Stages of Change TTM model by James Prochatska and Carlo Di Clemente, and John Norcross as well, who the authors of this particular theory, which was a systematic model of behavioural change which they introduced in the late 1970s, early 80s, and which they called a trans-theoretical model, TTM, or more simply, a stages of change model. Now, these researchers, scholars, were interested in how to promote better public health behaviours, actually, and they were thinking about how do we get people to give up smoking, to become less obese, to change their lifestyle, to what the challenges here in persuading people to give things up and adopt a more healthy lifestyle so as to reduce cancer and heart disease and other health issues. And they were interested in variations between individuals and what was the differences with the individuals who did achieve it and those who didn't. What were the differences in those who were successful in their smoking cessation, or in giving up gambling, or in giving up alcohol, and what could be done to support individuals to make these difficult changes and to make positive decisions. And that's one of the things that I kind of want to alert you to, really, that in our work to persuade and encourage and support children and give children the tools to change their behaviour, I think sometimes professionals can underrate, I should say, how difficult this could be for those children. And just as we're the adult, we presume that kids can just go ahead and do it. And particularly with children with disabilities, moving out of often quite embedded patterns of behaviour can be extremely challenging, extremely difficult, mentally draining, tiring, and require from them a huge amount of faith and of bravery, really, sometimes, to make changes in the face of anxiety and stress and difficulty that they're experiencing. So I think it's important that we think about the difficulty of some of the changes children can face. So in the 80s and 90s, TTM was widely adopted and relatively successful in smoking cessation, gambling addiction, alcohol, and in also bulimia, eating disorders and other psychological problems. TTM, the model, is stages of change model, trans-theoretical model, whichever we wish to call it, has faced some criticism, and there is a shortage of research studies in an educational context. It is relatively unused, undeveloped, it seems, in educational settings, but nevertheless it has achieved quite moderate, reasonable success in the health context in achieving behavioural change. So there's no obvious reason why this should not work, and I do commend it to you, really, to try to think about. You will probably be aware of some of this from your own life. It comes fairly intuitive, and it seems to have seeped into our culture. Here's the model, anyway. Prochaska, De Clement and Norcross argued that there are specific points to behavioural change, and that understanding these phases of behavioural change can help us sustain and achieve success with that change. And this applies, of course, to interventions potentially. So thinking about how we can not just plan for, not just begin, but also maintain and sustain interventions and move children towards success, so that behaviours are fully, the various term, extinguished, so that behaviours, the positive behaviours, are really embedded, and that the child can move on with their life. So avoiding the chance that our interventions will fail and won't be applied correctly and effectively. So here's the stages. We've got the pre-contemplation stage. I don't need to change. You may experience this with children, thinking about assignment 1 and assignment 2, even things about children you've chosen there, the child you've chosen there to focus upon. So is the child willing to change? At the pre-contemplation stage, it may be the child is not willing to change, and therefore these are the children that you probably wouldn't want to choose for your intervention, for your assignment 2, certainly assignment 1 or assignment 2, because they're not ready for change. It's not going to work with them. They're not there yet. So it might even be with them in your classroom. You might need to do some work to them to get them to a point to want to change. Now, moving on down the list, people at contemplation stage, these are the ones who are potentially amenable to intervention and to change. And these might be the children that you want to pick for, assignment 1 potentially, certainly assignment 1 and potentially assignment 2. Think about children that there's a realistic chance that your interventions would work. You could actually achieve change. And then once you've got the child or young person on the road of change, there's the preparation phase, the pre-change phase, where there may be anxiety and worry about, will I fail? Can I do this? I don't know, can I do this? Can I make this change? Can I stop screaming, shouting? I don't know, what else do I do? How else do I do that? How else do I communicate my needs? So there might be some anxiety here. Particularly when we're dealing with ingrained behaviour patterns, there will be, there's some difficulty here, and particularly when thinking about children with autism, where change can be an issue. That flexibility, cognitive flexibility, may be an issue, and transitions between one state and another, and it may be an issue. So. And then there's the action phase where the person is busy changing, and often they're absorbed with that change, and we hope they are. If the intervention is working, they should be. And then there's the action. There's a maintenance phase where our change needs to be maintained and carried through. And there's a risk here during maintenance and action too, but there's a risk here of relapse, of moving back into previous modes of behaviour. So there's always a risk in our plans, and that's something to think about in assignment 2, of course, about how have we made provision for what happens if the intervention doesn't work? How are we going to, we can do things like we're going to monitor it regularly, we're going to make a realistic intervention, we're going to bring in other professionals to support us in doing that, we're going to involve the parents. All of those kind of things can be brought in to make it more likely that we can maintain, and the child can maintain that alternative behaviour, and that this new positive behaviour that we want them to adopt. So, and our strategies I talked about in the previous presentation about how we explicitly teach alternatives for negative behaviours, for alternatives to negative behaviours, so that the child has new positive ones, and how we can structure that to help us have the most chance of achieving that, rather. Now, the final stage in this is the termination stage, and this is the one where you may hear people say, I'm never going back to how I used to be, and they may have is the stage. If they reach that stage, that's probably it. I mean, obviously there will always be a small chance that they'll have a relapse, but at that point it's very unlikely, isn't it? And this is the stage you hear where people, have given up smoking and smoked 30 years ago and are never tempted now again, or people have given up gambling and used to gamble 30 years ago but are never tempted again. And with children, you may hear, particularly higher functioning children with high functioning autism, may be able to have that retrospect and say, I don't do that anymore. I don't scream anymore. I don't hit anymore. I don't have tantrums anymore. They may be able to look back and reflect on that in some cases, and certainly they may be able to tell you at the maintenance level that, no, I'm trying hard, I'm doing well. give you some indication that they are putting effort in there to make those changes. So there's the stages of change model. Now, I want you to get into the pairings you had earlier in Activity 1, and I want you to reflect now on whether the TTM model, this stages of change model, applies to the last time you had to make a major lifestyle adjustment. So think back to Activity 1, where I ask you to pick and reflect on a lifestyle adjustment, and now think about, I want you to just reflect on this model in terms of your own experience that you identified earlier when you made a big change. So I want you to just discuss this with your partner if you're in a social setting. And remember, you can pause this to enable you to do that. Okay, moving on. Now, one of the advantages of one of the things that we're asking you to do in this, and this essentially is the ideal model for the PBS process, for positive behaviour support model, and these are the parts of it. Part 1, we see a behaviour, then we conduct an FBA, which is assignment 1 essentially, and then we carry that through into a positive behaviour support plan, which is assignment 2. And then in the real world now, moving away from writing assignments for university, and not the real world, you know what I mean, the real world of practice, were you to carry that through, you would then carry that through into real interventions in your classroom, and you would review your plan, and then you would adjust your plan, or even produce a new plan if it wasn't working, if things weren't working. So this is your process. Assignment 2 are functional assessment of behaviour. Assignment 1 rather is a functional assessment of behaviour here, and assignment 2 is the PBSB, which is your positive behaviour support plan. Yeah. So that's the topic. That's the course. Okay. We're asking you to design a positive behaviour support plan for assignment 2 and conduct a functional assessment of behaviour for assignment 1. Okay, that's what you did. And you used your functional assessment of behaviour to help as part of how to inform your positive behaviour support plan. Yeah? And talk. Okay. Now, look at where it might be interesting. I've superimposed here the trans-theoretical model, or stages of change model, whichever one you call it, on this process. And it's interesting, actually. I think this is one of the values of the trans-theoretical model, is that it actually helps you think about this PBS process. It matches nicely with this process, which is where, a child initially with the behaviour, maybe at the pre-contemplation stage, they're not aware of the need to change until they're made aware by other adults or whatever, or their own actions. Then they're at the contemplation change, and then we're at the preparing to change, and this goes in the plan about what we're going to do to help them prepare. And then the intervention or support is the action. That's, they are changing. Here's the intervention is helping them change. And then the maintenance is a part where we review their changes to make sure that they are, they're realistic and they're working, they're actually doing the job, the changes are happening, our intervention is having an effect, look, it's working, these are the changes that are happening with the child. So the model fits quite nicely, actually, with this PBS process of, behaviour, FBA, produce a plan, feeds into it, sets out interventional support, and we review that and the plan, we adjust it, etc. Now, in my experience, this process, which stretches across assignment 1 and assignment 2, a positive behaviour support process, where you do functional assessment of behaviour and you do a plan and then you feed through into interventions, informs interventions, can fail at the following points. Now, of course, these are things strictly for this topic. Obviously you're going to write up in your, particularly in assignment 2, you're going to point out, aren't you, of course, about how you're going to produce a plan that's realistic and achievable and detailed and rationalised. Well done, tick, tick, tick. Yeah, great marks. You've got some good marks for that one. And we're going to be very happy with your plan, which is realistic and achievable and has a rationale in it and has to be, as you describe your data collection procedures and as a description of how you determine the effectiveness of your support programme. That's all great. Now, of course, were you to follow on and actually apply this plan in the real world afterwards, after the topic, after you've completed this topic, these are some of the points in my experience at which it can fail. It can fail because this is stress points, as it were. You pick a child either for your plan or in the real, or actually when you're writing your assignment or in the real world, and suddenly one day the child's not there. They've had an escalation in their behaviour, they've blown up, they've done something, they've been excluded from school or setting. They're no longer with you. Yeah? So they've gone. The child has left the building. That's it. And that happens quite often. That's quite often attrition. It's called. It's quite a dropout. It's quite difficult. It's really difficult to work with. You can't achieve change because there's just discontinuity all the time. Okay. Now the next stress point is the action point. Okay, you've done your functional assessment of behaviour. It's lovely. You've done your plan. It's a really good positive behaviour support plan. It's lovely. It's rationalised. It's thought through. You've done everything. You've handed it in towards and you've got a good mark. Oh, great! And then you want to actually do it in reality. And the plan goes in a filing cabinet, and no action's taken. So it's just a plan. It doesn't actually happen in the real world. So that's a stress point, and I've seen that happen quite a few times. Now the next one is your maintenance. That's the next stress point, really, where we don't know if this plan is actually working. It just doesn't get reviewed. The interventions are put in, it's planned, you do your FBA, you do your plan, interventions are in your plan and are carried out, brilliant. Nobody knows whether they've had any effect. And it may actually be that they've had no effect because no one monitored it, nobody checked it, there was no regular review of the child's progress, nothing terrible happened, the child wasn't excluded or whatever, but there's not any indication either that it had any effect. Okay, so you don't know whether it's been effective or not. And that is the final stress point, really, I suppose, is that the final danger point, stress point, is number 4, is where we know things are not working. We've done great, we've reviewed our BPSB, but we never came up with a new one. For some reason, the cycle was broken, and even though we kind of discovered our intervention wasn't working, we didn't actually find an alternative. So nothing happened. So there's no benefit. Now they're the stress points. And remember, just to emphasise, for the purposes of this topic, you're going to be conducting a functional assessment of behaviour. That's assignment 1, and for assignment 2 a plan. But I'm talking about beyond that, if we were actually to carry that out, some of the stress points here to think about. And of course you can also use those insights to make sure that your plan is a really good, rationalised, clear, realistic, time-bound one that actually would work in reality. So that will help you with assignment 2 in particular, by thinking about this, as well as in your work at practice outside of the topic. So here we go. Here are some of the benefits I've just gone on about. I think the TTM has for educators. I think it can help us and the child consider change in a more holistic way. And you could actually, particularly with high functioning children, talk about parts of this model, talk about the stage, and get the child to think about it as a process rather than as just one thing. Because if they can recognise the process and challenges in the process, the bit where they're likely to fail, then you alert them to that and work with them on that, then you can help them avoid those pitfalls and smoothly move through the weak points, the parts where they might fail, where older behaviours might re-emerge and negative behaviours might suddenly reappear. Get them to avoid those. Raise their awareness of those. So it can help our awareness about a bit of a process, and it can also think about, practically for you, selecting children to carry out the process with, to carry out our functional assessment of behaviour with, and to design a plan and then to intervene. Because if the child isn't ready, they're at the pre-contemplation change, the kind of, it's just not going to happen, it's not going to work, then we have some effort to make to bring them further along the process so that they're at the contemplation stage. And if we can't do that, then we need to rethink, I'd suggest. The TTM also, another benefit of it is it captures different motivational challenges that a child might face at different points in changing their behaviour. And as I said earlier, we can recognise this in what we do and what we say. And when we support a child, thinking the child's vulnerable here, this new behaviour, this new positive behaviour is looking a little bit fragile, they might be about to return to their old negative behaviour, whatever that was. And therefore we can put some extra support in at that point. So, final point is, the TTM, I think, is in terms of as a cognitive scaffolding, I guess, cognitive process, and an educative process, is helpful for them to think about. It fits nicely with a cognitive behavioural perspective, because it helps us to think about what triggers there are for the unhelpful negative thoughts that led to those unhelpful negative behaviours, and what might we do to stop them coming back, to stop a relapse, and to ensure that we maintain our positive behaviour, our new positive behaviours. What preparation as well do we need to make sometimes to help us do that? What preparation does a child need? And that could be support from parents and all sorts of different issues to help them have the best chance of achieving change. So, thinking about this in the larger issue as well is that life changes occur at different points in our lives, and again, thinking about the process of change, these can have a quite profound effect on our capacity for change. And if thinking about how we help children themselves make choices, positive choices around their behaviours, which are related to personal autonomy and to growing, and to things we will want children with autism or other developmental disabilities to develop in order for them to avoid dependency or learned helplessness, and in terms of them making active choices about their life and about changes they make. And part of this, of course, is about carrying out these changes is to help them see that they can make positive choices, that they can make choices about their own conduct, and sometimes even to make them understand the costs of negative ones too. If we're giving them the freedom to change, then we have to give them the freedom also to fail and to make negative choices, but we point out what the downsides are of those really clearly, and persuade them that the positive choices are the best choices. So here are some practical implications of what I've all been saying, and which can kind of feed into how the bigger sense of how you design assignment 2, and also think about really your actual practices in classroom. So, for us to be specific about the consequences, positive and negative, of behavioural choices, to encourage and scaffold choice, to give children frames to think about what they do next in the behaviours. Throughout, for us to model positive behaviours and attitudes, and to have a positive regard throughout, and to show this really in how we are toward them. To identify points of possible relapse, risk in the process of change, and there should be some small recognition of this, I would suggest, in a really good assignment 2, where there's some recognition made of what happens, are our interventions realistic and achievable and all the rest, but also what happens if they don't work. How will we determine the effectiveness of our support programme? How will we do that? How do we bring that across, really? Final thought, the TTM model, Chains of Change, has had some support from research, and functional behaviour analysis has too, and both tools arguably help educators to adopt a high level of mental flexibility necessary for a critical, reflective view of their own practice, because they're getting us by thinking more deeply about how children change their behaviours. We're also learning, becoming experts on how we can adopt change and be more critical in our own practice, and that can only benefit, that level of criticality and self-reflection can only benefit assignment 1 and assignment 2, but also of course our practice out there in the classroom. Final sceptical last thought, just to throw a spanner in the works, is that I said at the beginning about FBA, and we're talking about you adopting a data-driven, research-informed approach to your practice, which loosely, FBA being based on the scientific rationale. Now, a final thought is that there has been some criticism of this, and Adi and Dillon in their excellent myth-busting book Bad Education say, despite the laudable desire expressed by some educators and some policymakers to base educational practice on evidence, it must be admitted that education itself is not a science. So, although we are encouraging you to adopt and think about this scientific approach and the FBA, functional behaviour analysis, and be systematic and gather data and all the rest of it, certainly never drop your critical faculty, because there are some who would argue that actually that's the most essential thing that we need to have, and that it's not, education is not wholly amenable to science. So I'll leave you with that critical final thought and say thank you for listening. For more information and advice, again, I'll recommend my book, particularly Chapter 6, and say thank you very much for listening. Goodbye.